Foam rollers are increasing in popularity as a way to treat muscle injuries. Part of the reason for that is they are lightweight and inexpensive. New York 1's Bree Driscoll shows us how they work.
During a trip to Mendoza, Argentina 3 weeks ago, Mark Jelly decided to kick his adventure into high gear.
They do this horse ride where you ride up the Andes Mountains to see the sunrise.
While the scenery was gorgeous, the after effects of the ride were not.
Over the course of the day, eventually I was kind of hobbled over and could hardly walk or stand up straight.
It turns out Jelly injured his back on the ride. When he got home, he continued to feel pain and his mobility was limited. He went to see physical therapist Dr. Karina Wu, who recommended he started doing a series of exercises using a foam roller.
And down. You can use a foam roller for joint mobilization, soft tissue mobilization, core stability, and even balance and agility.
The rollers can treat a variety of injuries over different parts of the body. They come in various size, shapes, and densities. There are also smaller stick rollers that you power by hand.
They are very inexpensive, they're lightweight, they're durable, they store easily in the side of the room.
Dr. Wu says foam rollers have been used in physical therapy for decades, but the development of smaller stick rollers have increased the treatment's popularity recently. She says while they can be extremely effective and are easy to use, be sure you are utilizing them properly.
So you need to know to be rolling on muscle tissue versus bone tissue, because there is a difference and you can cause injury if you're just trying to smash down on a bone that you think is a really tight muscle.
Jelly says since beginning treatment, he's felt significant improvement, and now looking back on it, he doesn't regret being a little adventurous.
I wouldn't have changed it for the world. I probably would have tried to stretch before, and I don't know if it's possible to take a foam roller on vacation with you, but maybe think about doing that next time.
Dr. Wu says if Jelly adheres to his home exercise program and continues to correct his posture, he will be back in the saddle in no time. Bree Driscoll.